you? This is again Dr. Jean Galindez, and I'm very glad this afternoon because we have a very special guest. Yes, of course. All of our guests are special. Yes, and on this video, we will tackle something very interesting that I myself is very curious. But before we discuss all of these things, let me or allow me to introduce our special guest, Mr. Roche Ruiz. Yay!
Good day, Dr.
Oh, good day, yes. And we are also, by the way, at a very special place, which I love coffee kasi.
Wow.
Oh, yes. Yes. Ano nga yung coffee shop?
Cafina.
Cafina.
We are now at Cafina Brews.
Oh,
This is in PF Paranaque.
Paranaque, yes. Kasi we actually visited this very nice clinic and looks like a hospital. But we decided to have the discussion on the cafe kasi I love coffee.
Alright.
Okay. Roche, or Roche, I've been asking him kung how I should pronounce his name. Is it Roche or Roche?
My friends call me Roche, so you can
parang mas
Roche is
social.
okay.
Oo, Roche mas social.
You can call me Roche.
Okay. So, Roche, can you say something about yourself for our dentists who are watching the video so that at least they can get to know you and why is it that you will be the best person to discuss our topic today? Yes.
Okay, Dr. So thank you very much for the opportunity. It's really a great avenue for me to share the knowledge about the topic today. DMD Center provides us an opportunity to provide more information to the dentist, which really is a great avenue. It's a great tool for the dentist to get lots of information. I've been doing a lot of probiotics, if I may say, probiotics lectures, also product presentation for the past 20 years. So,
okay.
So
pero Roche, you're not a medical doctor, di ba?
Yes,
you're not also a dentist.
Yes.
But and basically your profession is into marketing.
Correct.
And your wife is a dentist.
Correct.
Yes, that's why you got into this business.
Correct.
Yes. And basically, how long have you been doing marketing in medical and dental field?
If you combine the experiences, through the years, I've been doing marketing for pharmaceutical industry, for medical industry, and dental industry for almost 21 years.
Okay.
So, it's quite a long years.
Yeah.
Mahaba na.
So, but you graduated in advertising,
Correct.
marketing,
Yes.
and
So, I finished my degree at Colegio de San Juan de Letran, major in marketing.
Okay.
Major in marketing, but it doesn't end there. The program, so I find like I want to study more. So I enrolled in master's degree.
Okay.
So I enrolled in master's degree in perpetual health.
Okay.
So I finished tagal na, no? 2006 pa.
Okay.
So it's a great way to learn marketing.
Okay. So basically, you got into this, the topic that we're gonna discuss, which is doctors, it will be probiotics, correct? Yes. So, how did you get into the business of probiotics?
2001, I was actually 1998.
Okay.
1998, my doctor's cousin invited me to join the pharmaceutical industry, wherein I will be leading a lot of people and introducing a different kind of product to a medical doctors.
Okay.
So basically, medical doctors and target market.
Okay.
And I was tasked. I was given an opportunity also and a big responsibility to learn this microorganism on the regular, monthly, yearly basis. So I was tasked to travel and study this microorganism, the in and outs of bacteria. So that is my introduction.
Sige. So, na-introduce ka sa bacteria.
Yes.
Okay, no. Roche, let's discuss it in general first. Okay. So, what is the meaning of probiotics in general? Like, what does it mean, really?
when we talk about probiotics, Doktora, ang daming definition, but is it a positive bacteria, good bacteria? But last 2001, they have finalized, settled the definition. It's a live microorganism which, when consumed in adequate amount, will confer a health effect to the host. So whatever is the host, whether it's mouth, gut, skin, or women's vagina. So those are the hosts. Yeah.
So that is the general meaning of probiotics. Okay. And then, now, as you mentioned, diba, the host is the oral cavity, the stomach or the gut, and then the skin, and then the vaginal or private parts.
Yeah.
Okay. Okay, so
we are used to that.
Correct. And now, of course, since you are talking to dentists, so let's focus more on the oral cavity.
Okay.
Okay. So, in the probiotics, what is its function when it comes to the oral cavity?
Actually, there are three main functions of these probiotics if we're talking about oral cavity.
Yes.
Number one, it actually prevents caries.
Wow, okay.
Number two, based on the scientific evidence that we have, it reduces the inflammation.
Okay.
And number three, it also reduces the gum bleeding. So, at the same time, we have number four pala, prolonged use of probiotics will also directly or indirectly prevent halitosis.
So, interesting.
Yes.
So, let's do the four function one by one.
Yes.
So, does it mean that is there a general term of probiotics for dental, or it's also called probiotics?
Yeah, it's called oral probiotics.
So you just add oral.
Yeah, you just add oral.
Okay.
Of course, there are different brands.
Okay. So you said it prevents caries, correct?
Yes.
Okay. So is the probiotics in preventing caries considered as a treatment or a maintenance?
Yeah, that's a very good question. Now, for all the dentists there, if we're talking about prevention, we usually consider that as a maintenance. So we are preventing
so like vitamins.
Yes,
you take it every day.
Yes.
Okay. Yes. And the dosage for preventing caries normally is what?
Yeah. One tablet usually it's given every other day. So that's good enough for you to be able to prevent children, especially for having caries.
Ayan, talking about children, because of course dentists are also parents,
correct.
So basically, if you is there a specific dosage for children, or is it the same for adults?
Yeah. One good thing about probiotics, Doctora, is number one, there's no contraindication registered. So this is what we call the GRAS, generally regarded as safe, all probiotics. But for children, we usually give one tablet every other day to prevent caries.
So for the prevention of caries, whether you're an adult or a child, one tablet every other day, or for adult, it can be every day.
Recommendation based on the studies is one tablet every other day for prevention of caries.
Caries for life,
you can take it.
But if you have dentures, you don't need it. Okay, so after we discussed the prevention of caries, the second one is, you said, it prevents the problems when it comes to the gums or the surrounding tissues of the oral cavity, which is very interesting,
yes.
So, so when it comes to, for example, bleeding of the gums, this is already a specific condition, So, is the probiotic here, when you take it, is it considered now as a treatment, correct?
Correct.
It's not anymore maintenance, yes. So, you just take the medicine at the oral tablet, or is there another way of introducing it to the oral cavity to address the condition now of the gums?
Very good question, Doctora, and very good observation. Because when we talk about perio, it's already a disease. So we need to address this immediately, and you have to visit the dentist right away. Of course, but this probiotics will work. It has two preparations of probiotics. So the first thing that you are going to introduce is the syringe type. It's a liquid,
okay.
where it is a liquid, you insert it directly to the packets. Because when you do have the perio problems already,
okay.
meaning to say you do have accumulated bacteria inside the subgingival. So we have to address that. Insert it with the probiotics powder, and of course with your scaling, of course. Then after the scaling, of course, you give probiotics tablet at least 10 days.
Very interesting.
Yes.
So this is for halimbawa, they have gum disease already, correct?
Correct.
Yes, like pyorrhea.
Correct. Yeah.
Is there like a stage wherein probiotic cannot do anything anymore? Like for example, in terms of the gums, like if it's already advanced, like if there's motility of the tooth already, can it still be safe?
We have findings that if the tooth mobility is too severe, like stage 3 or 4, we cannot promise the patients anymore. So as a good dentist, of course, you have to know your limitations and also the adjunct treatment and the medicine. So even if it's so good, but really you know for the fact that it cannot be safe. So we don't really like to overpromise to our patients.
So parang overpromise, underdeliver.
Yeah, we don't want to do that.
Yes. So but this powder that you are talking about, this is prepared by the dentist, right? By us.
Yes.
Yeah.
So this is only given to you. To the dentist lang.
Okay. And then how do you do they need a special machine to introduce it on the packets or the free gingiva, or it's just the syringe?
Yeah, it's just a syringe. You just aspirate 1.5 ml of water.
Okay.
Then you shake it for like 3 minutes. Then it will turn to be gel. So it's now ready for administration.
Okay.
And it will definitely work wonder for perio cases.
And now, how about, for example, extraction? Does it because the third one you said is inflammation, right? So let's just say there's a case of impaction, for example, or major surgery. Can they introduce this powder or liquid, the powder that they will mix and use it as a form of irrigation during surgery?
We have not encountered that kind of situation.
Okay.
But we firmly believe it will also benefit the patient. But so far, we have not encountered that. So
because normally before, I mean, I'm not a surgeon, but basically, if you do extraction, you try to clean the socket, or especially in impaction or there's too much bleeding.
Yes.
I think the inflammation will be addressed better. Kumbaga, the post-pain and the post-op pain or the inflammation may probably lessen if you use this also.
Yeah, because Doctora, you're correct, because this probiotics, it has two basic properties. Actually, it is three properties. Number one is it is what we call, there's a competition mode. So because bacteria is alive, they have to eat, they need to have nutrients. So it is a never-ending battle inside the oral cavity.
Okay.
Number two, it has antibacterial natural properties. So basically, that's why it helps for those inflammation.
Okay.
I just want to state one classic example, Doctora. Scientifically proven, 60 to 70% of pregnant women, 101% suffers from gingivitis.
Correct.
And of course, they are not allowed to take any other antibiotics.
Yes, correct.
So what better way, if you're a dentist and you have a patient who is pregnant, actually, you can give probiotics. And it is proven to be very, very effective. The tablet lang
But it is safe.
Yeah, safe
for
safe.
pregnant women.
Yes.
It is also safe for lactating mothers.
Correct. Yes. So those are some,
advantageous.
Ibang mga dentists, they are quite hesitant
to give.
Don't be afraid.
Just provide.
Right information.
Yes, and then so we have the prevention of caries, addressing gingival or periodontal conditions, and then we have addressing inflammation, and then the fourth one was it can even, because it addresses the gut or it can later on prevent halitosis.
Correct.
So, the halitosis thing is, it. Do you mean it automatically addresses also, like, just to be clear for everyone, because I am confused as well. Okay, so is there a separate probiotic just for oral, or if you take the probiotic for oral, it already addresses all the environments that you are talking about, like the private parts, the stomach, and the skin?
Correct. That's again, another a very good question again from a very intelligent doctor. So,
mukha lang yun, kaya nagtatanong eh.
So we have a specific bacteria because specific strains for a specific illness. But all of these bacteria works as a team also.
Okay.
So as I said earlier, the definition, if you're going to take adequate amount, it will confer a health effect to the host. So if in connection with the oral cavity and the halitosis, if you're going to take this oral probiotics, it has properties to address the oral issues. But whether you like it or not, anything in excess will just flows down directly to the gut, to the small and large intestine. So indirectly, there is a direct correlation between how you the lozenge that will be in your gut. So it addresses the issue, but you have to take it continuously for 3 months. So it is not overnight.
Interesting. So it means that when you are trying to take probiotic as a maintenance, this kind of like affect the oral flora of your mouth.
Yes.
Correct?
Yes.
And then hopefully prevent a lot of problems in the oral cavity.
Systemic
problems. Specifically, like for example, because cavities are created by bad bacteria.
Correct.
Yeah. So, and then if there is a specific condition that you want to address, then there's also a specific dosage, and then there is a added application of probably a powder that you mix into a liquid and directly placed on the affected area. Correct. So now, since you said there's a lot of this is a live microorganism, correct?
Yes.
And then supposedly these live microorganisms are good microorganisms, correct? So it means that in the oral cavity, what is specific good microorganism that is introduced in the mouth that specifically addresses the mouth?
Correct, Doctora. So there are 4 major genes, or what we call angkan ng mga bacteria. So we have number 1 is the Lactobacillus group. It has multiple, 100 of strains. Number 2 is the Bifidobacterium.
What's that?
Bifidobacterium or Bifidus.
Bifidum.
Number 3 is Enterococcus.
Enterococcus. Yes.
And number 4, of course, the dentists out there are very much familiar with Streptococcus. So when you talk about Streptococcus, it's not only bad, it's not only mutants. There's also a good side.
So, Roche, the bacteria or the microorganism that you mentioned, these are all good microorganisms, correct?
Correct.
Yes. And then, as you mentioned earlier, there is a general probiotic, and then we have the oral probiotics. So, does it mean that when you're taking a general probiotic, is it still necessary for you to take the oral probiotic? And what is the advantage of taking oral probiotic as well?
If we're taking the general probiotics, there's no harm in taking also the oral probiotics, because what we have said a while ago in the early part of this program, specific strains works for specific illness. So there are specific strains for the gut, there are specific strains for oral cavity.
Okay. So in the oral cavity, what are the strains or microorganism that is effective to address the problems or maintaining the proper oral flora of the oral cavity?
There are actually a lot of registered probiotics strains, but there are 2 main strains that really works wonder for your oral cavity.
Okay.
Number one is Lactobacillus Brevis
Okay.
and Lactobacillus Plantarum. So these are the two major strains that will work wonder for your oral cavity.
Okay. So the Lactobacillus Brevis and Lactobacillus Plantarum.
Yes, yes.
Oo, parang ano yun? Parang feet.
Galing-galing.
Oo, okay. So you mean that even if the patient is already taking the general probiotic, it is still safe for them to take an additional oral probiotic. Parang the general probiotic is like multivitamins, di ba? Yung multivitamins wherein all of the good microorganism or live microorganism is there. But of course, if you want it to be more concentrated, then and the situation is you want it more concentrated on the oral cavity, it is also good
Yes.
to get an oral probiotic.
Correct.
Okay.
Perfect.
Okay. Now, another question. Is there side effects when it comes to probiotics?
That is usually being asked, no? But Doctor, all the registered under FDA is all probiotics are GRAS.
Okay.
So this is what we call the global standard, generally regarded as safe. No?
Okay.
So even Doctor, we have conducted a local study using the probiotics last time. That was
Okay.
7 years ago. No?
Okay.
Even those suffering from cancer with nagre-regi therapy, we had a very good significant. This was actually conducted in Cardinal Santos Medical Center.
Wow,
Wherein
okay.
very good effect.
Okay, so let's just say lang, so it is safe for children, safe for pregnant women,
Yes,
correct?
yes.
Lactating mothers and also adults,
Yes,
diba?
yes.
So, and then sa children ba, is there a minimum age that they can take it?
Yes, Doctora, as long as they can chew, so more or less 2 years old above,
Okay.
they can take, but usually pag medyo 22 years old, hinahati yung tablet.
Or
They can only,
they grind it and then include it in
if
the
it's,
milk?
if it's safe at malinis, then
Yes.
they can do so. But if they are not
okay.
secure about the safety and
Yeah, yung
cleanliness,
transfer.
opo. So,
Oo.
usually 2 years, okay na.
2 years old. Kasi they can already swallow.
Only the tablet. Doctors
Only the tablet. So, as long as doctors, the powder that you mix in a liquid, it is more for treatment.
Correct.
Okay. Okay. So, basically, let's go to the business side of the probiotic for dental practitioners.
Correct.
So, they can literally prescribe this, right, to patient,
Yes.
like all patients that they have, right?
Correct. So as I said, prevention of caries, halitosis, gum bleeding,
okay.
inflammation, perio. So you can prescribe these probiotics, or can you?
Yes.
Prolacsan.
What is the
Prolacsan.
brand?
The brand
Prolacsan.
is Prolacsan.
Okay.
Doctora. So Prolacsan, it has 2 strains. The tablet contains 1.2 billion bacteria that will repopulate the flora.
Wow.
So just 1 tablet, you can prescribe this. So it is being sold for 30 tablet at, we only sell to dentists. So these are being sold to dentists ng Doctora.
So this is not available to the drugstores?
No. It is only available to you. So for the dentist lang po. And we don't sell to patients. So they cannot get it from any other sources but to your office lang.
So the dentist will buy it from you and then will sell it to the patient.
Yes.
So we won't have a problem prescribing them with automatic direct selling to the patient.
Correct.
Okay, so and normally the initial number of tablets that is has already an effect, kasi normally these kinds of medicines, especially for maintenance, is accumulative, diba? So, of course, at least there is a minimum number of tablets so that you can at least see a difference, correct? So, what is the minimum number of tablets that you can offer to your patients?
Ang advice natin, Doctora, for 10 tablet after prophylaxis,
Yes.
so they need to have at least a take-home meds,
Okay.
10 days.
Okay.
So it will protect them from bacteria accumulations, especially if they are not in your office.
Yes.
They can tell a lie, or they will
Yeah, correct.
Then
Yes.
this is happening. So 10 tablets is the minimum for
Okay.
each patient after visiting your office.
Okay. So, but if for maintenance, for example, like for example, you excuse me, you wanted to advise it as a maintenance, not as a treatment.
Yes.
What is the minimum number of tablets?
So they can get 30 tablets per box.
Okay, 30 days.
Yeah, 30 days. It is only sold at 1,500.
It's not that expensive, And how much? And how much the dentist is gonna buy it from you?
Standard patient price is 2,500. We don't recommend to lower than that. We don't recommend lower than that. It's 2,500 for patient. For doctors, 1,500.
Okay. So yung 1,500 is the amount that the dentist will pay your salespeople who sells this, right?
Yes, yes.
And then we resell it at 2,500
Yes.
at a maximum suggested retail price. You don't suggest really expensive ones.
Correct.
So kung
And the good thing, Doctora, is
yes,
because we have a number here. If
Yes.
they call us, we ask them who is their dentist. We don't sell to patients. We don't sell to patients.
Okay. So it says here, it's not actually swallowed like a medicine.
No.
It's dissolved in
Yes.
the mouth.
Yeah.
Okay. And then it is also recommended after brushing.
Correct.
Parang siyang mouthwash.
Yes.
Yeah. And then 30 minutes before eating or drinking. Does this also help for, kasi naman, some of the doctors there know I have a bad habit. So does this help for smokers like me?
Yeah, I firmly 101% suggest that you take this once a day. You'll have a fresh breath every day, and it will prevent you from 8 hours bacteria, maximum 12 hours bacteria accumulation.
Roche, have you tried already like taking this and then the following morning you don't have morning breath?
Yes, I'm actually taking it once every other day.
Okay.
And wake up in the morning, so far so good.
So si Doc hindi ay yung wife niya hindi wag mo ako halikan. So
and in our clinic we actually prescribe a lot. So we call it for the dentists out there. Of course, there's a way for you to be accredited like bacteria replacement therapy provider.
Wow.
So we provide bacteria replacement therapy. Yeah.
Alam mo, I think one of the challenges of the dentist is that they don't know how to properly market something, like when I lecture Roche, I always
I've seen you lecture several times.
I teach, I tell dentists to imitate how dermatologists does their business. Kasi alam mo, mga doctors, ang dermatologists kasi, yung treatment nila is like the dentist. The treatment is just one part of their business. But the most lucrative part of their business is giving you a lot of stuff after the treatment. Which is like this, since this is very good. I mean, if, it's similar to Yakult, di ba? Yung Lactobacillus, ano ba yung sa may Yakult? Kasi.
Shirottos. It's actually kasi.
Yeah, okay. So, is this one, more on the gut, yung Yakult?
Yes.
More on the gut siya, no? Rather than the oral.
For diarrhea.
So basically, talagang it's been there for quite some time, di ba?
We have been introduced to probiotics, good bacteria, positive bacteria-friendly bacteria since 1935, the first commercial available probiotics in the world. But actually, in time of memorial, we have probiotics from the soil since birth.
Okay. Hindi, talaga naman kasing ganun Meron talagang good and bad bacteria. Parang good and bad cholesterol, di ba?
Correct.
So, anyway, let's go back to probiotic when dentists are prescribing it to their patient. Now, in terms of preventive in caries, I think this is very important, especially on children.
Yes.
So, is there a special effect or additional effect of like Prolacsan when you prescribe it to children?
Correct. That's again a very, very good question.
Okay.
Number one, Dr. There's a study in Sweden. It was conducted last 2006 using probiotics. Group 1 and Group 2, 591 children have been subjected to this particular research. And the study shows that Group 1, with a normal diet, sugar, milk, food, they have monitored for 7 months. Then the Group 2 is normal diet, sugar, milk, regular diet with the probiotics. And you know the findings, Doctora? It's so amazing. Those who are the Group 2 with added probiotics, there have been an inhibition of formation of biofilm, the plaque. And number 2, the inhibit formation of Staphylococcus mutans of around 22%. So that's really amazing. I think this has great potential for your patients as well.
Kasi, especially, yung parents. I feel that parents now are not like our parents before. The parents now parang minsan overactive. Which is good for us. Kasi nga, I guess it's a good thing, especially for pediatric dentists, for lowering down the caries incidence in your clinic. Diba? Parang it's a good reputation for you if most or it depends, again, as I mentioned when I lecture, the practice of dentistry is about conscience, di ba? So, of course, if there's a lower incidence of caries, medyo sad tayo na we don't earn from treatments. But I believe that if you provide good oral health on your patient, and that's the reason why we became dentists in the first place, I think this is a very good option. Yes, and plus it is not that expensive. So basically, just to summarize, Roger, what we've discussed is that probiotics doesn't have really a known side effect.
No.
And
generally regarded as safe, GRAS.
And then they can be taken every day for maintenance once a day. And then it's taken like 30 minutes before eating, drinking, or you also take this after toothbrushing, morning and evening. And then for treatment, is there a different name for the treatment, which is the powder and liquid?
It's the same name, Prolacsan gel. But the bacteria are more concentrated because, as I said, this has 1.2 billion. That gel contains 6 billion. So it's more powerful because it's really a disease.
For treatment talaga yun.
I would just like to highlight, Doctor, if you may. So this Prolacsan, comparing to other probiotics available in the world market, it is more effective of 580%. And this is the only one that came from the human healthy oral cavity. Because there are a lot of bacteria that is already only cultured from other laboratory, then they will just place it in the real product. Doctor, this was extracted from the healthy human oral cavity.
And is this manufactured here in Denmark?
Yes.
CMS
Dental. World class in terms of dental innovation.
So they can prescribe this to even pregnant women. And then for children naman, as long as they can already swallow. Tama ba? At least a minimum of 2 years old. Ayan. So can we open para we can try and let so it's white in color.
Like this.
And then
you just take it. And
parang chiclet?
Yeah. It's like lozenge or the popular brand of mint.
Sarap.
And feel refreshed, actually.
And then, is there other flavor?
In Denmark, it has mint flavor and strawberry flavor. But in the Philippines, we currently have one. So maybe soon. It has no sugar.
And can you take this more than once? Like if you're, if you like.
If you're a smoker like one night, you can take 2 probably. But based on the papers that we do have, 1 is enough.
So mga colleagues and doctors, you know, Roche here, I was so interested in probiotics. That's why I tried to get in touch with him, because what we are trying to do here on DMD Center is to provide you a lot of information that can enhance your practice, at the same time improve your treatment for your patients. And I hope you've learned something about probiotics on this video. And if you do have any questions, we will place below on the description their contact numbers, or you can ask questions in the comments, and I will try to answer it. If I cannot answer it, Roche here can answer it for you, because he's the best person to ask it. And do you also conduct lectures, right?
Yes,
about marketing and stuff like that. So, babalik pa siya kasi while behind the scenes, we've been talking about a lot of things that will help our colleagues or dentists like me to improve their practice. And that's really the main goal of the DMD Center. So anyway, if you are interested to prescribe Prolacsan to your patient, you will find the email and contact numbers of Roche here. I think you see Roche everywhere else in their events of Philippine Dental Association or dental chapters, and they can also invite you, right, for
yes,
any lectures. Yes, actually, it really tastes good. So anyway, colleagues, thank you so much for staying and watching the entire video, and we truly hope that you've learned something from it. And please don't hesitate to ask questions or make comments on how we can even improve our service better. Thank you so much. Thank you, Roche.
Thank you very much.
Yes. Bye-bye.